Welcome, everyone, to the 7th event in our Diversities series and the third conversation explores the language of change, a collaboration between Shared Studios and Planet Word. As a part of today's Diversities event, we bring you experts in social influence, health, and health-related messaging from around the world to explore how language is used in health-related messaging campaigns, strategies for communicating public health messages to communities, and also the limits of messaging to address health-related issues. I'm Brandon Furter, the Director of Global Community for Shared Studios, and I'll be moderating today's event. And I am joined by Rebecca Roberts, Curator of Programming for Planet Word. Rebecca, would you like to tell everybody a little bit about Planet Word and our collaboration?
Thanks so much, Brendan, and welcome everybody. I'm Rebecca Roberts. I'm the Curator of Programming at Planet Word. Planet Word is a new museum of words and language in downtown Washington, D.C. That's it in my Zoom background. We are closed at the moment for COVID reasons, but we very much look forward to reopening soon as it's safe. And in the meantime, we're really able to bring these virtual programs together, which has been such a delight to partner with Shared Studios, hear voices from all over the world, talking about how words and language impact various aspects of society. So I'm surprised to hear this is our 7th one together. It's gone very quickly. And I think I've learned something at every single one of them, and I hope that you all will too. So thank you for being here.
Thanks, Rebecca. And we feel so honored to be partnered with Planet Word, and we've explored a number of different topics having to do with language, from things that are a bit more fun to things that are serious. And I think that today's conversation will provide some additional insights into something that's been on the top of a lot of people's mind right now, health and health-related concerns and the messaging around them. So without further ado, I want to introduce our guests for our panel today. From the US, we have Dr. Bradley Adame, an associate professor in the Hugh Downs School of Human Communication at Arizona State University. He studies risk perception and social influence and has developed a persuasion theory for applied contexts, including risk perception, natural hazard preparedness, and concussion reporting behaviors. Welcome, Dr. Adame.
Thank you so much. I'm happy to be here.
And from one doctor to another, but across the world to Afghanistan, we have Dr. Khalid Salar. He's a medical doctor from Herat, Afghanistan, where he works with World Vision International, designing and implementing aid projects, including drought and flood response, and most recently, the response to the COVID-19 pandemic in Afghanistan. Welcome, Khalid.
Pleasure to be here. Thank you, Brandon.
From Afghanistan to Paris, but via Mali, we go to Leila Kita, a partnership officer at Kabako Academies in Bamako in Mali, a social enterprise catalyzing tech education for sustainable futures in Africa. The Kabako community turned the pandemic into an opportunity for youth entrepreneurship, using local solutions to meet communities where they are in the fight against the virus. Welcome, Leila.
Hello, everybody. Very nice to join this conversation.
And now to Uganda. Humphrey Nabemanya is the founder and CEO of Reach a Hand Uganda. He is a globally recognized leader in civil society organization and adolescents, youth, and sexual reproductive health and rights. He is an expert in behavior change communication for sexual and reproductive rights and HIV/AIDS awareness across Uganda. Welcome, Humphrey.
Thank you so much, Brandon. I'm so happy to be here.
It's so great to have all of you here, and at a particular time when health and health-related messaging is definitely on the mind. I want to kind of organize our thoughts today into two key components. The first being kind of strategies for health-related messaging and social influence, and then really focusing in on some of the limits of messaging alone, and what are the limitations of language as we think about language through the lens of Planet Word's objectives here. But I want to start with you, Dr. Adame. Can you tell us a little bit about your work in social influence and health-related messaging? And specifically, I know that you've developed a theory called vested interest theory that's been used to better predict the efficacy of particular types of messaging, including health messaging. I wonder if you could share a little bit more about the work that you've done as it relates to health.
Yeah, absolutely. I'd be happy to. So let me just start out by saying that, theory and language are very important, but I think probably the most important aspect of persuasive health messaging and probably the most overlooked aspect of persuasive health messaging is the need for formative research. And so what a lot of messaging, especially in America, overlooks is this idea that we need to go and talk to the people who are at risk and figure out what their needs are, and then develop messages that are based on those needs. And so that, I think, is above all other things, probably the most important aspect to creating an effective health message. Beyond that, then, once you have an understanding of what your audience's needs, what their perceptions are, the barriers they face, things like that, then you can start to apply theory. You can apply meaningful theory. And so what we typically do is select from a range of theories that that we think are going to work in a given aspect once we have an understanding of our audience. And then we can apply those theories to then understand particular variable relationships, predict certain outcomes, and things like that. And so more specific to Brandon's question, one of the theories that I use often, that I've kind of been developing, is this theory called vested interests. And its basic premise, or the basic question it tries to answer, is why is it that we can hold certain attitudes about our health specifically, but then those attitudes don't necessarily predict our requisite behaviors. And so I might have an attitude that towards my own health, that I want to protect my health. I have attitudes, and that I don't want to die from COVID, let's say, or I don't want to catch COVID. But then when we observe people in the world, if we ask them, like, hey, are you willing to catch COVID? Are you happy to be able to die from it? And people will say, no, of course not. But then you watch their behavior in the world, and then you see them not washing their hands. You might see them not wearing a mask, or in America, we're encouraging people to not dine indoors because it turns out that that's a really effective way of spreading COVID, dining in an indoor restaurant. So we have these attitudes towards self-protection. We have these attitudes towards wanting to live a long and healthy life, but those attitudes don't necessarily predict the subsequent behaviors. And so the purpose of this theory then is to try and figure out what that mismatch is, and then design messages that then create a more coherent match between those attitudes and the relevant behaviors, right? So tying this attitude of self-protection, this attitude of promoting health, to the behaviors then of wearing a mask, washing your hands, social distancing, things like that. And so there are five sub-variables within the theory. So there's stakes, salience, certainty, immediacy, self-efficacy, and response efficacy. And what the theory tells us is that when we perceive all these variables to be high, then our attitude should predict our behavior. And if you're interested, I can talk about each of those variables specifically, or
yeah, I think I don't know if we'll speak about all of them independently, but I do think there are several here that are interesting for us to explore in the context of some of the work that our other guests are doing as well. And one thing that you mentioned, Dr. Adame, is specifically that it's understanding people's needs prior to engaging in any sort of messaging. And I think, Humphrey, this is something that Reach a Hand has been really successful at. I'm wondering if you could tell our attendees a little bit about the work you do at Reach a Hand, and the way that you are specifically meeting audiences where they're at and figuring out what their needs are prior to creating health-related messages.
Yeah, thank you so much. Once again, Humphrey Naimanya, Reach a Hand Uganda. Reach a Hand is a youth-serving movement that addresses issues around sexual reproductive health and rights, stroke, HIV, and AIDS-related issues for young people. And one of the things that we realized was to approach young people, not only in Uganda, but all over the world, you have to speak the language they really understand. And also we can now see a big shift when it comes to major events that are happening in the world, especially in Uganda, looking at politics on how they are using a lot more of music. And now looking at us as Reach a Hand started a long time ago to use music as one of the way to reach out to the young people, doing health camps and flash mobs as the way to reach out to young people, in terms of looking out what can really attract the young people to understand the whole instance of sexual health. in terms of like, if corporate companies can do bigger concerts, then why can't Reach a Hand as well do sexual reproductive health related events in form of concerts to help us reach as many young people as possible with information that also can drive in terms of changing the attitude of how sexual health is being perceived in the country, and as well changing, impacting them skills that can also give them the proper attitude to access services, proper attitude to address issues around reproductive health issues, and also looking at how our culture in Uganda, especially, whereby it's driving so much of our morality. We're looking at the religion, it's also driving so much of our morality, but it's leaving out the realistic issues that young people really face, and who is there to really address them. And also we are looking at the conservative ways of communication. For example, if you go to churches, are the bishops and priests are the owners of this information, are the ones that say what is right and what is wrong. If you look at the new trends on how they're communicating the gospel, it's about through dance, through music, through so many kind of creative ways, and also they're attracting as many masses as possible. So when it comes to change of attitude, in terms of right now we are faced by the huge pandemic of COVID, and we understand that there was so much communication that created a lot of stigma around COVID, and also so much information right now that is demystifying the stigma around COVID. So the reproductive health issues that we've been living with for centuries and centuries, and most of them, those are the challenges that young people really go through, looking at the high teenage pregnancy rates in the country, looking at the gender-based violence rates that are increasing on a daily basis, looking at so many women that are dying in hospitals due to lack of improper health service and healthcare system in hospital, looking at the biggest challenge that we're having, that even up to now, the 21st century, like our country, is fighting against sexuality education, and sexuality education is one of the most important part of someone's life's growth and also change of lifestyle. So we come in a different way, using different mediums, movies, music, using influencers, like those are kind of celebrities that we have in the country, so that they can be ambassadors of change in creating the attitude that that our community, especially our young people, really need to start embracing each other, starting loving themselves, and also the most important part, to make the informed choices in life. So that's what Reach a Hand has done in terms of also having young people at the forefront of being the army of themselves. Let them communicate to one another, and we eliminate the kind of teacher role to the student role, but young people communicating to each other. And that's why our motto as Reach a Hand is young people for young people, in terms of let's make research, understand one another, understand how best can we communicate to one another, and we're able to change our societies. And since here we are seeing it right now in politics, music is playing a big role, and that is something that was really like never looked at, and it was surprising them. And also looking at our current president as well, going backwards, and as well trying to also be a musician, try to attract the young people. So that's what really attracts the young people. If you start speaking the language they understand, they will follow you, they believe in you. Pastors speak the language their masses understand. When I mean pastors, I'm talking about religious leaders. Now also they're speaking the language that people understand. So if it comes to sexual health communication, COVID-related messaging, and also in terms of communication, how do you make people understand that? So we have been promoting a lot of safe sex, but condoms were kind of looked at, not even embraced. But when you tie in messages around sexual pleasure, but you're not telling them that how you use a condom, this is how it affects, or this is how it protects, but you're bringing someone who's embracing of like, if you use a condom, you're going to enjoy yourself, you're going to be happy and all that. So don't talk about like, if you use a condom, you're protecting yourself from HIV and all that. That's the major goal. But how can you promote sexual pleasure? By letting young people understand that if you use this, you're going to enjoy yourself, but at the end of the day, you're protecting yourself from something even bigger. So that's the kind of way that we communicate to young people in terms of making the message lighter. Let's stop talking about numbers and statistics and all that, because they might not really understand that kind of language. So it's about making your information lighter, as much also enjoyable and colorful for them to be attracted to what you're communicating to them.
Yeah, there's a couple of things there that that I'd like to build off of in relation to both Humphrey, what you're talking about, and Dr. Adame. One for you, Dr. Adame, is I'm wondering if one of the ways that we can create more effective messages is by figuring out a community's needs first. What are some strategies that we might use to better understand those needs? I think Humphrey is really kind of talking about specifically before they've engaged in message creation, they're really understanding the community of young people and the things that they're interested in. And so that helps shape the messages. I'm wondering if there's particular strategies we might use to engage certain communities.
Yeah, I think that, there are a number of different strategies, and the one you pick is really dependent on context. I do a lot of kind of quantitative survey-based research, and so I recently was involved in a project looking at concussion reporting in collegiate athletes, and so in the U.S. the collegiate athletes are overseen by the NCAA, which is the National Collegiate Athletic Association. There are a series of rules and all these regulations and things that have to be obeyed, and all these conditions that have to be met in order to play collegiate sports. And so in that instance, it was really effective for us to go and just create a survey, have them answer questions, and look for statistical trends in the data to kind of see how they understood their risk of not only suffering a concussion, but also how they then understood their risk of subsequent health responses or health consequences after a concussion. That was super effective. It worked really well for us. I'm working on a project right now where we're looking at, so Arizona has recently legalized the use of recreational marijuana for the state. And we also have a major Native American tribe, the Navajo Native American tribe, which is a sovereign tribe within the state that also shares territory with Utah, Colorado, and New Mexico. And so we're not sure if they're going to also legalize marijuana, and then what the health consequences might be for the Navajo population. So we're ramping this project up, and one of the things we've done to try and understand and get kind of an insight into what their needs and what their media uses are is we've started dialoguing with tribal leaders, and we're just getting this project started right now. And so we're talking with people who are familiar with the tribal dynamics and trying to engage those leaders. And so this process is almost the exact opposite of a quantitative kind of survey-based approach. But I think it speaks to what Humphrey was saying, is that you have to, at the very beginning, I think it's important to at least kind of observe the population that you're trying to help, and then start to dialogue with the leaders and the dialogue with the opinion leaders, and go and try and figure out who those people are, and at least do your best to observe, what media are they communicating, what media are they consuming, and then you can start to get in and understand then, again, like where are these messages occurring, where are they originating from, and once you have an understanding of that, then you can start to tailor your techniques, and whether that becomes, again, from kind of a scientific perspective, I would say that, once you have that information, you can say, okay, is a qualitative approach going to be better? Should we be going and talking to these people, meeting face to face? That's something that's very important that we're discovering for the tribal leaders in the Navajo, is that they want us to come to them and meet with them face to face, and dialogue with them, and meet the tribal healers and things like that. For the collegiate athletes, that they're so busy already that same strategy would not necessarily have worked very well. So the end goal is the same for both projects, but the strategies are very different. And Humphrey, when you were speaking, it sounds like what you were describing sounds like exactly what we're trying to accomplish with our project with the Navajo tribes, is figure out what media are they using, what types of messages are meaningful to them. So for instance, like we found that internet access is very limited on the Navajo tribe, but it turns out that they still consume a lot of radio. So a lot of people listen to the radio, a lot of people still read newspapers and things like that. And so those radio broadcasts and newspaper articles probably would not be effective if I was trying to reach a similar population here in Tempe, Arizona, of ASU students. If I was trying to reach 18 to 24-year-old ASU students, radio and newspaper would be the worst way to go about it. But in the Navajo tribe, like that might be the most effective media to use. And it sounds, again, it seems like it's very similar to the work that Humphrey's doing. So,
Yeah,
so again, I think that's sort of the basis of how you would start that process, I think.
Yeah, and I wanna continue that and move into adding Layla and Dr. Salar to the conversation here, specifically about engaging communities and their needs as well, and then relying on local solutions to particular problems. But before we do that, I want to get our attendees who have joined us today involved in this to understand the effects of health messaging and the types of messaging that might resonate with us. So we're going to put up a couple of images, and I encourage everybody to engage the chat. What we're going to do is, this is a recent health-related messaging campaign for the wearing of masks in the response to COVID-19. We're going to show you this one, Love Thy Neighbor. And then if Victoria could move to the next one. And then here's another strategy. So Miles, miss birthday parties, back to normal is up to you. Do you miss offices? Back to normal is up to you. And then do you miss rock concerts? Back to normal is up to you. And I'm wondering for our attendees, if there is a particular one of these messages that resonates more with you. If so, just put the back to normal in the chat, or if love thy neighbor, put love thy neighbor. I'm really interested in hearing from all of you, which of these are most likely to make you wear a mask. Got a lot of love thy neighbor here. How about for our panelists? Which one? Oh, miss rock concerts. I miss rock concerts too. Back to normal. Back to normal. Okay. Love thy neighbor. So it's interesting here for me to see. It seems like about an even split as the messages are coming in. And I'm wondering, I feel like these two messaging campaigns, coming back to you, Dr. Adame, about kind of the way that we create strategies to meet particular needs. I feel like these two campaigns are working to meet very different needs. And I'm wondering if you could talk about, why someone might be resonating with one over the other, as the folks are outlining in the chat.
Yeah, I'd be happy to. So can I ask you real quick where these campaigns originated?
They're all US-based campaigns.
Okay.
Some of them are, that's a really interesting question. I'll be interested to see if you can guess which one is from a college campus.
Man, I'd have to probably see them again, but I would say that just having viewed them for just a few minutes here, I think that they're really looking at dimensions of culture and trying to. So one is really honing in on this idea of collectivist and kind of a group effort, collectivist culture, and the other one is obviously very focused on, more individualism, right? So one is saying like, love thy neighbor, right? So that if you protect yourself, you're also protecting other people, and implicit in that is this idea that we have to get through this thing together. And so, there's been campaigns in Arizona talking about how my mask protects you and your mask protects me, and it same idea that we are interconnected, we are all in this together, and so I think if you have a collectivist mindset or you understand collectivism to a degree, then that one is going to resonate with you. The other one is really focused on individual desires and the things that we have had to as individuals sacrifice here in America in order to combat the virus, right? So what do you miss most about your life before all of this started? And then really, again, kind of implicitly providing an avenue back to those things. So if you miss this about life, then wear a mask and you'll have all of these things back. And so they're, again, focused on kind of this individual desire to do what I want, to go to concerts, to eat at a restaurant, all these things, right?
Yeah, it's also interesting, and this hadn't occurred to me until some of the folks in the chat, specifically someone named Chris J said, I prefer love thy neighbor. The second one is assigning too much blame, not creating positive emotions. So thinking about the emotions that particular messages create. And then someone else had mentioned in the chat, a couple of people about the graphics as well. And so when we think about a message, and I think, Humphrey, this speaks to a lot of work that you do. Also, when we speak about a message, it's not just about the words. It's about who's delivering the words. It's about the way those words are delivered, in this case with graphics. And I want to move to Dr. Salar and talk a little bit about, the words themselves are limiting, but we can add, famous people to communicate those words. We can add really great graphics that people connect to. But in some situations, the words and the messages themselves are simply not enough, no matter how they're dressed up. And I'm wondering, Dr. Salar, if you can talk a little bit about the work that you've done around COVID-19 in Afghanistan, and the ways that you've had to move beyond just messaging to engage lots of different strategies for communicating these health-related concerns to the community.
Thank you, Brandon. And I think just going back to what Dr. Adami and Humphrey were saying, I think it's important to really understand the context that you're going to be working with. And once you understand the context, then you can, whatever program you're trying to implement there, the intervention that you have in mind, then everything will come together. One of the things that, so I work with World Vision International in Afghanistan, and World Vision does 8 projects and programs. And I've been working through the response for the drought, the flood response last year, and recently with the pandemic that happened. The pandemic actually hit Afghanistan really hard because Afghanistan, most of the society, most of the population, they live under the poverty line. So keeping that in mind, when you're thinking about the messaging, then you should understand what if, like, I recently had a project that closed in February. So the project that I was working with was designed to deliver aid during this pandemic to the population. And what we were focusing on was that people lost their livelihood. And also, one of the other important elements of that intervention was to make people aware of the pandemic. And how we were going to message that was depending on many factors, because if we just went there and delivered a great message to them, considering the wording, the culture, and everything, again, that would have been inadequate, because then they didn't have the means to, let's say we would tell them to wash their hands and wear masks, then they would say we don't have the means to wash our hands and wear a mask. Because also, keeping in mind the economy really got hit. So what we did was we considered a cash assistance program along with our main goal, which was to make people aware of the pandemic and also tell them about the ways of the prevention. So the cash assistance would deliver an amount of money for them so that they could provide their most needs, the basic needs. And even then, we would cut an amount from that cash assistance, buy a hygiene kit, deliver that along with the cash assistance, and then we would finally get to what we actually want to do, which is the health messaging for the pandemic. Right. And how we approached them was exactly what Dr. Adami was saying. So there, we analyze the context, and what Humphrey is doing, they're going with music, and because that's the language for the young people. And for us, the context that we are working is the suburbs of Afghanistan. So keeping that in mind, who would be the most influential figure for the suburbs in Afghanistan? Obviously and definitely it would be religious leaders, because that's what they look up to. So we went with faith leaders and religious leaders, and we trained them in advance from all the target locations. We trained faith leaders, And then we equipped them with all the knowledge by actual doctors who were giving them pandemic awareness trainings. We equipped them with the skills we wanted, with the information we wanted them to convey to the target location. And then they went back to their communities, and they would conduct sessions, pandemic awareness sessions, and then they would tell people about the pandemic, how to prevent the pandemic, because, and also keeping in mind, the population that we are trying to reach are mostly not educated. So, in the beginning, the pandemic was just a rumor for them. They would say, it's not in Afghanistan, it's in the rest of the world, it's not going to affect us. All these sorts of rumors. And if like me, if I walked into the village and said, hey, I'm a doctor, there's a pandemic, they would say, you guys are saying this because you want to do blah, 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 So that the same message coming from a faith leader, from a religious leader, has tremendous effect on them. And then, through our project, which was 5 months, we reached more than 2,000 participants in the sessions that the faith leaders conducted. So 2,000 people were trained by only 20 faith leaders that we trained. So, it's really, the messaging could be very effective. It could be well-researched and everything. But when it comes to the context that we are working, you need to really go in there and understand that what are the limitations of your work going to be? Well, are you, like through the intervention you're doing, are you really going to achieve what you're going for? So, I guess like in our part, we had to really look into a lot of things until we got our message to the content, to the population that we were trying to give them the message.
Yeah, thank you. I think something that's come up across the board is a certain level of authority. Who has the authority to deliver a particular message? With young people, for Humphrey, that is musicians and different influencers. For you, Khalid, it's a focus on faith leaders. And I know, Dr. Adame, you're looking specifically at, what mediums do we then communicate the message through? So it's interesting to hear about, who's communicating the message, what is the medium through which the message is going to be communicated, and then subsequently, how is that going to be met by a particular community, which starts from identifying that community's needs first. And this brings me to you, Leila. I want to talk a bit about the work that the learners are doing at Kabaku, and specifically how you turned this moment and into kind of a space for entrepreneurship. And the thing that I'm most interested in as it relates to health-related messaging is this idea of starting from the community's needs. And you really, and the learners at Kabaku really worked at finding community-based solutions. And so I'm wondering if you could tell us a little bit about those solutions and the effectiveness of that through different messaging strategies.
Yeah, sure. Thank you. I fully agree with the fact we really need to hear the local population and to adapt the message to their need. And so at Kabaku, as you said, we have taken up the challenge arising from the global pandemic and turned it into an opportunity for African youth. And so in June 2020, we launched a cohort for 7 months for 20 learners to make entrepreneurship a viable solution to the economic and health-related consequences of COVID in Mali and also in the Sahel region. And so we supported 6 projects offering innovative tech solutions to COVID, also providing long-term job prospects to young people, and having a real impact for local communities. And so what is really important at Kabaku is that we follow a project-based approach. So learners imagine and prototype a solution that answer local issues faced by communities. And they also offer affordable solution. And so one example was the mask project, which was a great example showing that small-scale manufacturing business is working in Africa, and that young people are resilient in this health crisis. And so our learners have designed and implemented a decentralized supply chain for the local production of masks. So they produced nearly 100,000 masks distributed by the Malian government to local and international organizations and to population. So what's interesting in the process is that they work with traditional sewing workshop in Bamako, and they also used a distributed model to address the frequent power outages in the city. And so they generated decent work and decent salary for 20 people and indirectly support their household. So that was a great success. And what is interesting is how the project was perceived by the Malian population. So I have testimonies from Kadidiatou and Fofana, who are Kabaku's learners, and explain me, they were part of the project. So they explained me how the population react to the project. And so Kadidiatou said that in March 2020, so during the project, it was what we call the first wave of COVID. So she says that masks were very popular and attractive, that there was kind of an euphoria, and very few Malians were out in the street without masks. So the project gets a lot of support. And afterward, she says that today Malians stop believing in COVID. They really live normally. And she said that no one could verify the authenticity of the disease, and that Malians have to see it to believe it. So that's something very interesting I found. And Fofana said to me that opinions on their project were 50-50, half positive and half negative. So on the one side, it was great to provide masks to fragile and people who can afford it. But on the other side, some considered that it was a way to make money out of the pandemic. So he says to me that Malians often think that it's a commercial disease. And as Kadidiatou, he says that people don't believe in COVID today in Mali, that messages from the public administration are really contradictory, and they are not showing example. They do not respect, like they close schools but not restaurants because they like restaurants. So it's really not, they are really not showing example, and that wearing masks is mandatory when working in public services, but the majority of Malians work to earn a daily living and not in public services. And so they can't afford to stay home or social distancing. So poverty is also an obstacle, like in Afghanistan, I think, to respect these measures. So I found it really interesting. And so, yeah, that's basically the idea of how the project are perceived, and I think it's interesting in Mali to see that.
Yeah, and this, you speak to something that I know, Dr. Adame, you've written about, which is the ineffectiveness of contradictory messages. I'm wondering if you can talk a little bit about why consistent messaging around health-related issues is so important.
Yeah, I think I actually I wrote a note about that as you were speaking, Leila, that contradictory messages are extremely problematic. And I'm looking at the chat here, and I think I lost it, but there's somebody regarding the messages that you showed earlier. Someone said in the chat, they said, why should we believe this if our leaders don't believe it? And it's a poignant comment. Yeah, Marsha Akrish said, type that into the chat. And I think that there are two complementary things going on here. One is that, like, if you have inconsistent messaging, then what people tend to do is believe the one that best suits the needs they already have. And so we've had that problem here in America where the initial COVID response was left up to the individual states. And so you have 50 different states, you have 50 different responses, which is extremely problematic. And so some states went on lockdown very early, they went on a hard lockdown, and they stayed on lockdown. Other states did not do any of that. And then within each state, you then have people who are saying, well, why is California on lockdown when Texas is completely open? And, and then they just say, well, this is complete junk, right? This whole thing is ridiculous. And then the other thing that, that the commenter just said is that at least in America, much of that problem was an artifact of poor leadership. And so in this case, if we had good examples that were set by our leaders who were also then providing consistent messaging, I think that we would have had very different outcomes here in America. And so just a couple of recent examples, so I'm originally from California. I follow California news very closely. And there was, the governor of California was trying very hard to motivate people to stay on lockdown, to wear their masks, things like that. And much like the rest of the world, this was having an impact on people's, on their income, on their jobs. They were losing money, losing jobs. They couldn't, people starting to lose their homes. And so this was really hard for a lot of people. And then, so you have the governor giving these messages, and then he's caught out at a very expensive restaurant having a party with 30 people. So he's violating all of the things that he is asking people to do, and he's doing them in a very classist kind of way. So he's at like one of the most expensive restaurants in California, one of the nicest restaurants, and he's having this party with a group of people. And so immediately people started to criticize him and say, well, why should I stay on lockdown if you're going to go out and have this lavish, expensive party? And so it's not only about consistency of messaging across the different states, but also having good leaders that set an example for you. And again, some of that will depend on culture, right? So depending on who the opinion leaders are in a particular region or particular culture, if you're in Afghanistan and you have these religious leaders saying, hey, we need to lock down and we need to do this, and we need to do that, and then they're out in public basically contradicting their own messaging, that can be extremely problematic. And also then, of course, having consistent messaging across a given area will help people understand the import of the problem, and also creates an environment where if you, at least again in America, one of the things that probably would have worked very well is to have consistent messaging, good leadership, and then basically create an environment where if you are the one who is if you are not obeying the health messaging, then you're kind of the one who's deviant, and then there becomes this social pressure to obey, even if you don't actually believe it, right? And so I'd be curious to see from the other attendees, like if that would work in their regions and with the problems that they're facing. But
yeah, Humphrey, I'm especially interested in what you might be able to add here, because I'm thinking about, you're relying on certain authority figures, musicians and influencers, but they have authority because of the communities that you're trying to reach. But I'm wondering, is there a problem with consistency in messaging around sexual and reproductive health in Uganda? Have there been moments where something didn't work in the way that you tried to deliver a message? And do you have an idea of why that might have been?
I think the most challenging bit that we're dealing with in Uganda, and also especially most of the African countries, is the perception around issues, around the messages that we have. You find that one is that with so many languages that we have in the country, that is one. So you find that what is meaning good in my language is meaning bad in someone's other language. So you find we have one common language that we all have to use, and that is English. So if it's English, is it really understood by everyone? So also there's a very huge challenges on that. So it becomes very expensive to translate in each and every language for everyone to really understand. So that becomes a very huge challenge that we have, that is directly on language barrier. especially that is limiting us not to reach as many young people all over the country. And so we try to use the major languages that are within the vicinity that most of the population really understand. But as well, we are not that contented that we are reaching out to every young person, even if we are using like different mediums. Then another thing that we use is that sometimes music works for some people, but also we resort in terms of creating TV series or TV movies. And, like right now, even where we are heading, we are looking at content being the biggest factor in everything that we're doing. So media platforms are there, but one of the things they're lacking is content. So
Right.
there are few movies, for example, being produced in line in communicating what Richer Hand does. So also it becomes expensive for us now to venture into producing content that other people can really consume in line with what we are doing. So at the end of the day, messaging becomes quite really expensive in one or the other. But also we have looked at different dimensions like the use of TikTok, and also creating short movies with your phone and all that kind of stuff that can really even go viral as much as possible. And also the people can really get the message. But the language barrier is one of the biggest challenges that we're having. Perception around reproductive health issues. And also this comes with the government policies, for example, that are hindering so many organizations and CSOs like Richer Hand to even communicate freely around comprehensive sexuality education. Like here, I'm talking about comprehensiveness, whereby there are restriction laws for us to talk about issues around abortion, around homosexuality, around so many other things that are really hinder so much of hinders the sexuality education communication to reach out to as many young people as possible, and also which results in creating attitude and a very friendly environment whereby such issues can be discussed freely. So those are some of the challenges that we do have, and also many African countries do really have.
Humphrey, thank you for your contribution. I think we have a question in the chat, so I'll go ahead and read that out loud. How can you get people to believe in a health issue that they cannot perceive? It seems that is a source of many issues with regard to the pandemic and individual response to it. I wonder if maybe Layla can speak a little bit about that, because she was saying how in Mali, COVID was being perceived as untrue.
Yeah, sure. It's true that I have a lot of learners at Kabaku saying that they are not believing in like the government message, and I think that the top-down message are not working, and that choosing artist or religious leader might be better, because I think that according to the testimonies I got, communities for Malian people, communities' priorities are, for example, to survive on a daily basis, collective social life, family and relatives, religious events. So it's not, I think it's important, for example, for Malian, wedding and baptism are really important. It's key of the social and familial life. And so maybe you have to use like people that are closer to the communities rather than governments, especially now in Mali, because there was political struggle in August. And so there is a transitional government, and the former government and the transitional one are not listening to people's needs, and it's not possible to stay home when you earn a daily living. So I think you have to go through other ways to message the measure for the COVID-19.
And going off of that, Dr. Adame, do you think you have maybe something to comment on that as well, based on the vested interest idea?
Yeah, I think that it's an interesting question, and especially because most of us rely so much on our senses to navigate the world, and you can't see this virus, but you can see the outcomes of it, right? And so if somebody gets critically ill, like that becomes something that is observable. And so in this case, unfortunately, I think, again, here in America, one of the things that people have responded to is like this personal kind of the exposure to personal consequences, right? So people didn't believe in it, they didn't care about it, they weren't wearing masks until someone they knew got sick. And that became something that was really critical. And so I think that that I think can definitely turn the tide for some people, which is unfortunate, but sometimes that's what it takes for some people. And there's research on all other sorts of health and safety issues where it doesn't become salient for people until it touches them personally. But going back to what Layla said earlier, that I think, and this is something that all the panelists have spoken about, is that the credibility of the message source is critically important. And so it doesn't matter, in many ways, it doesn't matter what we say or how we say it. If it comes from a source that our audience does not trust and does not believe in, then all of that is lost. And so, and again, much of that is really based on cultural dynamics and the context in which you're communicating. And so I think that probably, to answer Chris's question specifically, and going off what Layla said, that I think the way to do that is to find people that your population trusts. And so you have to find the opinion leaders, you have to find the people who are that carry weight in the community, and convince those people and get their buy-in. And then you start to get the buy-in from the rest of the population. And again, of course, using the specific language and tailoring the message to those audience needs with the help of a credible, with a trusted source, then can create messages that are really effective. And I think, Khaled, I think that speaks to what you were doing in Afghanistan and getting the religious leaders involved. And so.
Great, awesome. I will pass the moderator baton back to Brandon. So we just answered one of the questions in the chat, and I think we actually have another one here in the Q&A section. So if you want to take it away, Brandon.
Yeah, sorry about that. I know that there are limits to messaging, and there are limits to technology as well. So I experienced the limits of that just now. Unfortunately, my chat is now empty. So Victoria, do you want to throw me the question?
Absolutely. So we have a question here that says, in a world full of conspiracies, fake news, and misinformation, I am interested to hear how you're dealing with them and the challenges that imposes to the work that you do.
Yeah, that's a tough one. How do we counter some of the disinformation? I suppose that in each of your contexts, you experience different types of disinformation. I guess we can start with Dr. Adame. How do we counter some of that messaging? And then I'd be interested to hear from all of you about how that plays out in your own context.
Yeah, this is a brilliant question, and if I had a coherent answer to this, I would be probably a gazillionaire. The short answer is I don't know. This is an incredibly difficult, pervasive, wicked problem. Again, especially here in America, where we have just everyone has internet access, everyone has a cell phone, everyone can broadcast through social media. And so everyone has their own opinion, everyone has their own perspective. I'm actually, as soon as I sign off of this meeting, I'm launching into another meeting to talk about disinformation and how we can combat it. So again, the short answer is I don't know. I think that probably, again, having trusted opinion leaders and convincing them, but that might be a good start. But yeah, this is we're working. Let me say that there are people who are working on it, but we are just getting started. So
yeah, does anyone else want to jump in? Like Humphrey, I'm wondering, in your context.
In my context, and also if you look even what is happening right now, and also what was happening in the US for the last 5 years, what was treated as fake news to some people was the right news. So what was the right news to some people was the fake news. And we, being an advocate, sometimes people use conspiracies, misinformation to attack what is right. And also we as advocates, we have to use what is right also as well to attack the misconception and the conspiracies around different issues. If it comes, let's say, for example, in the sexual health manner that we're dealing with, you find that in sexual health, there are so many misconceptions around around, whereby I can give examples. You find that young people, they think that if you get pregnant, you can use a Coca-Cola, you can use Coca-Cola to wash, in your vagina, and you're not able to get pregnant. And you find that so many young girls are going to take that misconception as the truth. So we come in as well to provide the right scientific, like the right best information, based on scientific facts, to give, to address those misconceptions. So that's how we are able to address some of those misconceptions that really come. And also you find that opposition, for example, we've been having a lot of opposition forces that are even funded by different donors in the US, in Europe, to fight against sexuality education. And so they come with a morality kind of face, but not living out the reality part of it. And most of the information they try to put is so much it's a conspiracy, they're misinformed. And now we go back to the basic. What is the scientific fact around reproductive health issues? So we use the facts to address some of these conspiracies, but it's something that really continue to come up on a daily basis, but as well is to create information that is going to address the misconception, because there are so many myths, around different areas, especially on sexual health and also how young people really grow up. So that's how we are able to address the misconceptions and the conspiracies that really come within the work that we are doing.
Yeah, and I think both you and Dr. Adame speak to that's a challenge, right? There's always this misinformation. Dr. Salar, did you?
Yeah, so I actually wanted to speak of a very good example that happened in Afghanistan just in the beginning of the pandemic. There was this guy that he claimed to have made the COVID or the corona vaccine, which was, perceived by the people like in a very, disinformed or misinformed manner, and they actually believed that it was the corona vaccine, and thousands of people went and took it, and this guy made so much money off of it, and it was an opportunity, and had different departments of his vaccine distribution in different provinces. And eventually what his vaccine was, it was opioids and analgesics. It was a cocktail of opioid and analgesics. And obviously, if somebody gets the coronavirus, they will have headache, they will have body pain, and they will have all these symptoms. Opioids, as a medical doctor, I can tell you that opioids are going to give you a very quick relief from the pain.
Right.
But again, opioids are prone to give you apnea and lack of oxygen in your body. So if you really do have the coronavirus, it is going to be, infecting your lungs and will give you less capacity of your lung. And if you're taking opioids in that huge amount, you're prone to die. And that's what happened. So some of the patients who took the cocktail, they died instantly because the nervous system was instantly, was triggered to, and they had an apnea and they died of lack of oxygen. So, this guy was won over the government. They were not able to have a consistent messaging before him in regards to the COVID virus, so that he or people like him wouldn't be able to use an opportunity like that to, end up making a lot of money, but then also taking people's lives. Right. So that's a result of disinformation and also lack of consistent messaging.
Exactly. We've come to the end, and I just want to thank everybody for participating. And I think that it kind of came full circle in that a message's efficacy is dependent on the person who is communicating it, a consistency in the communication of health messages to avoid situations where somebody else can fill in the dots and take over the narrative, as seemed to be the case there with your example in Afghanistan. and really starting with the community needs. You know, I think that all of you are really committed to figuring out what communities need before you start putting together those messages. Thank you everybody who joined us, particularly the panelists, and thank you attendees for joining us for what's now been our 7th conversation. We have one more in the Language of Change series that we will be doing on March the 17th. And it's actually going to be quite interactive with a group of design futures thinkers. We're going to be looking at the language of innovation and how we can engage in certain questions that might help us to reimagine our future. So thank you everybody for joining us again for the 7th in the Diversity series. Have a wonderful day or night wherever you are.